morning, everybody. Dr. Santhan Gopal has demonstrated his most modern equipment, especially for amblyopia. But as far as India and all developing countries are concerned, is it possible to use such a costly equipment for all the patients? Because the prevalence is very high, more than 8% in underprivileged populations of India and developing countries. So I'm here to tell you something easy solutions for developing the treatment of amblyopia. Well, for amblyopia management, we have to think and rethink beyond visual acuity 20/20 or 6/6 vision. Everybody is trying to improve the vision up to 6/6, and after 1 month, 2 months, 3 months, or 6 months, the vision goes back again and again. The regression of visual acuity is also very high even after treating the patient for so many months. So what is the reason? For that, there are certain things that I am going to tell you now. Another thing is that the vision which we improve, the visual acuity, even if it is 6/6, it is a low level vision because it has no proper contrast sensitivity, discrimination and depth perception also. So a strategy to achieve high level and stable vision in a user friendly way with good compliance, that too at home. Let us see. It is my experience of only 50 years in this particular branch, and I am working on this amblyopia and all these things for the last 15 years almost. Well, over 100 years, in spite of trying different regimes, amblyopia management remains confused and unsolved. The prevalence is over 2 to 4% in worldwide population. Over 1.2% persons live with compromised visual related quality of life and being labeled as visually unfit when they go for different jobs, specific jobs. Let us come back to the definitions of amblyopia. They are continuously changing. There is changing concepts for amblyopia. We were taught, or it is also given in the textbook, that amblyopia is a unilateral or bilateral disorder. But as per the recent advances, it is a binocular dysfunction that both eyes have multiple visual function deficits like inability to discriminate crowded objects, color contrast, stereo acuity and so many things. Even if the better eye has almost vision 20/20, means vision is not of high quality. And the regression problem I told you is more than 25 to 50% cases they show regression. So again coming back, that amblyopia is a binocular dysfunction. In fact, the major mechanism is not the lazy state of the one eye, but the active inhibition of the amblyopic eye by the dominant eye, which disrupts the equilibrium between the excitatory and inhibitory signals. It needs to be tackled binocularly. There are more than 100 references for that. The people are using iPad, that to the binocular iPad treatment by binocular treatment. It has been observed by many researchers that unless the contrast sensitivity and the stereo vision, they are not developed properly, the visual acuity will regress again and again. So our aim is to target towards high level and stable vision by correcting the plethora of other visual functions apart from visual acuity, that too binocularly, as it is a binocular dysfunction. There is a complementary faster route to achieve high level and stable vision without any instrument or equipment. It's a very simple thing. Enhancing the contrast, there are so many references. During 2009 also they have started enhancing enhancing the contrast sensitivity function through action video games. When playing video games are beneficial, then specific video games, that is the latest one is in 2022. But when in 2014, Hussain and et al., there was a paper that the challenge of developing video games for improving contrast sensitivity. There are challenges. And we have accepted that challenge and we have developed certain games for improving the contrast sensitivity. And we have uploaded it on Lazy Eye Master Games on Android Play Store. The basic of this game is that we have to treat the other multiple visual functions deficits also, and especially the contrast sensitivity game is like this. There are different colors of the percentage of the same color. You have to tap that particular color and score the marks. Then one more axis game that is for especially for meridional amblyopia, and children can easily play. You can give tab to the children beyond after 2 years only. Screen time should be given to the babies after 2 years, that too only for 30 minutes with a 60% illumination. Thank you very much. You are most welcome for the next conference, SPOCI conference in Rishikesh on 9th and 10th December, dedicated to control blindness. Thank you very much.